早晨，大家好，歡迎大家嚟。
Good morning, everyone. Welcome to our iCON Health Forum, which is conducted in Cantonese. The topic is Stroke Smart.
First, we do learn acknowledgement. We want to say that UBC is located on the traditional, ancestral, and ceded territory of the Musqueam, and UBC operations are also on the territories of the Squamish and Tsleil-Waututh. We also like to acknowledge that you are joining us today from many places near and far, and acknowledge the traditional owners and caretakers of those lands.
我係何陳宇慈 Barbara Ho， 係一名註冊護士，亦都係安康健康網絡首席護理主任。今日咧，我係你大會嘅主持人。網上嘅朋友，大家好，歡迎大家嚟參加今日嘅安康線上中文講座嘅。呢個係誰有中風危機，應如何處理？
Now, simply put, I want to give you an introduction of iCON because some of you are first-timers. iCON is an initiative by the UBC Faculty of Medicine, the Digital Emergency Medicine, and the executive director is Kendall Ho. We've had this for 19 years. We also thank patients as partners, as our partners. We wanted to convey reliable and useful information to communities, to the indigenous citizens in BC, as well as family members and patients, provide them reliable and relevant health information on prevention and care of illnesses using technology so that they know how to manage, find technique to manage and lower the risks of having these illnesses. At the same time, we also will provide electronic apparatus, apps to the community to help them on improving health. We are very happy that we can invite, today we have invited the iCON program manager, Patsy Limebigler, to give us our opening remarks.
And I'm the program manager at iCON. Welcome to our 2025-2026 Chinese Health Forum, Stroke Smart, Awareness, Action, and Recovery. iCON has been hosting public health events with Chinese-speaking communities since 2007 to provide culturally relevant health information. We are proudly supported by the BC Ministry of Health's Patients as Partners initiative. Thank you for supporting iCON. We're very proud to bring you the Chinese Health Forum once again. Throughout the forum, you will learn actionable strategies for promoting positive behavior change at home, understand the roles in team-based care, and discover how to access essential health and community services. Don't forget to participate in the post-event survey for a chance to win a $50 gift card in our lucky draw. Thank you again for joining us today, and let's work together towards a healthier future.
Thank you to our program manager. Stroke is one of the reasons that affect us because millions of people suffer from a stroke every year, and it is the number 3 killer in Canada. So most people have the misconception that only old people suffer a stroke, but actually it can happen to everyone, despite the advances in medical technology. So we have to impart more knowledge to everyone because we think that comprehensive education on stroke will be very important for prevention of stroke in future. Today we have many speakers. The first one is Dr. Samuel Yip. Dr. Yip. He is now the Clinical Associate Professor of Neurology at UBC. He's also one of the directors as well as the resident doctor in UBC. He completed his medical doctor's degree at UBC and also at the University of California in San Diego to do some research on stroke.
工作咧係
He maintains stroke prevention and also treatment and also training new next generation neurological doctors. Welcome, Dr. Yip. Hi, how are you? Thank you for taking the time off from your busy schedule to let us know what is a stroke, whether there's any new information to be given to everybody. I'll hand you the mic. Okay. Today we're talking about, hopefully I can finish in 20 minutes. I'll be able to let you know to understand what is stroke and to understand the signs and symptoms. And you can identify the modifiable and non-modifiable risk factors and prevention strategies. And also learn how to do what to do when you suspect it, and also the process in the hospital. At the beginning, we want to know what is defined by stroke. Actually, there are many types of stroke. One of them is called transient ischemic attack. Actually, you can think of it as a more minor, shorter time duration stroke. Because of this focal brain or retina ischemia without infection. So the blood vessel, the sending the blood to the brain or the retina temporarily is impacted, so there's no blood to the brain, so the function is affected. So it's not like a stroke. Doesn't cause permanent harm, but the symptoms and signs similar to a stroke. It's just that time duration is briefer. So symptoms can feel that half of your body can move, or you can feel your speech function is reduced. You can't tell people clearly what you want to say, or you don't understand what other people are saying, or maybe you're slurring your speech, or your one eye vision in one eye perhaps is maybe pulled down, or maybe half of it is unable to see. This is all the signs of stroke. But temporary stroke, TIA, the time duration is shorter. Maybe it will last for a few minutes or maybe an hour. Usually it's a few minutes or 10 minutes, then that's the end. But sometimes the same thing might happen again. So this is also a warning sign of stroke. So if you have that sign and symptom, don't ignore it, because you don't think of it just a few minutes or several seconds and you treat it as nothing. Actually, maybe this is your next stroke in the future. Usually, I call it a minor stroke or ischemia. If the next stroke in the next month, there will be a 20 to 30% chance of happening again. So it's high risk. So if you have that sign, you must go to the hospital or talk to your family doctor. And also, another thing is stroke itself. What is it? Is focal neurological infection, or maybe there's hemorrhage. or the blood vessel burst, affecting the brain neurological function to function normally. This is a sudden happening. Actually, there are two types. There is ischemic stroke, and the other one is hemorrhagic stroke. Ischemic and hemorrhagic, with the temporary deficient of blood in the brain is similar. It's just sudden. It's just that the duration, TIA, is more temporary. Stroke is long term. Also, it will make you cause you permanent brain injury. I just said earlier, stroke can be classified into two types. One is ischemic. Is more common, it's about 80% of the cases. The reason being that the blood clot forms in the brain, or travels from the heart to the brain, though causing the blood cannot go to the brain to provide oxygen. So the part of the brain cannot function normally. Usually the reason being atrial fibrillation or plaque buildup, causing infection in the blood vessel. The other type of stroke is hemorrhagic. Hemorrhagic could be bursting of the blood vessel in the brain burst or rupture. The blood goes to the brain. Usually is due to high blood pressure or rupture aneurysm, because aneurysm ruptured. Or another one that you may see is when there's blood thinning medication misuse. You shouldn't misuse that. That will increase the risk. In BC, every year there's about 4,900 to 5,000 people need to be hospital because of stroke, and the mortality rate is about 13%. And I just said earlier, 80% are ischemic and 20% is hemorrhagic. Early treatment can reduce disability and death. Stroke is a major cause of disability in BC minors. If it can be rapidly assessed and treated, these are key to rehabilitation and recovery. I just mentioned earlier, if you want to avoid a stroke, there are some risk factors. Some are non-modifiable risk factors, not changeable. Some are changeable. Non-modifiable risk factors as your age, if you have previous stroke or transient ischemic attack, that would also be a risk factor. Your gender, your ethnicity, family history, they're all they would increase the risk factor. Other risk factors are modifiable risk factors. As for instance, hypertension, hyperlipidemia, smoking, cardiovascular disease, diabetes, obesity, high cholesterol, physical inactivity. These are all they all increase the odds of having a stroke. Going back to hypertension, hyperlipidemia, sometimes there's no sign, no symptom. Sometimes diabetes also may not have any symptom. If you have these diseases and you're not aware, or if you don't take your medication to control, then you will increase your risk of stroke. Sometimes you may not have the symptom, or you say, okay, I'll ignore it. I don't want to take medication. By the time you have a stroke, that it may be too late. So I tell my patients is those even though you don't have any symptoms, disease without symptoms, hypertension, hyperlipidemia, diabetes, you have to take your medication. Another is modifiable risk factors, atrial fibrillation. Sufferers who have atrial fibrillation, they have 3 to 5 times greater risk for ischemic stroke. More than 20% of all strokes are caused by atrial fibrillation. This is also there is a very good medication could reduce the risk of stroke. If you have atrial fibrillation, they have to listen to their doctor to take the medication, blood thinner. I want to say repeatedly when stroke, what's how it usually affects daily life. There are different parts in the brain. Different parts affect different function. Sometimes it's speech, some is your vision, your memory, some parts control your movement of your eyes and body movement. Different parts of the brain affected by in the brain, then there'll be different consequences. The most common is the face, arms or legs not able to move or numb. If your left brain has a stroke, then your right arm or face or legs may be weak or numb. Speech is difficult or unable to say what you say, or you do not understand what other people are saying. Most people having that is because the left brain having that, because the left brain controls speech. So if that side is affected, so it will affect your speech, or maybe you're unable to convey your message. And also vision loss, I just said earlier, it's just a curtain on one eye coming down. If that happens, even though it's just one eye, maybe after 2-3 minutes, maybe the drape is pulled up. This may be a sign of stroke. If it happens, you should go to the hospital. Or perhaps suddenly half sight or half vision, you can't see. You could see what's on the left and not on the right. So it could be the back of the brain, the part that controls vision has got some trouble. Another type is sudden onset of severe headache. I never had any severe headache before. Perhaps just like in a second severe headache that's never experienced before. So perhaps it's also this bursting of rupture of an aneurysm prelude. So if that happens, you should go to the hospital right away. Other maybe dizziness or loss of balance. I'm not talking about a light dizziness. I'm talking about like the world is spinning. And that if you have other symptoms, numbness or double vision, or I'm saying if you have double vision or you're slurring your speech, or you feel that you have problems swallowing, or when you walk you are leaning to one side, this could be symptoms of stroke. You must go to the hospital right away for help. Actually, I just said earlier there's many symptoms. The simplest, you can use that logo to remember. I call it FAST. represent the face. If your face suddenly droops, are not balanced, a sudden onset, like usually is balanced, suddenly one side of the mouth droops, or at the same time you can check if other people, you can raise your arms to see whether your arms, whether you're unable to raise one arm, or maybe one arm falls down slowly. There's A is for arm. The third is speech. Whether speech is clear, whether you are clear enunciation, or maybe you can say things that you want, or maybe words that come out are jumbled up, or but you can hear people speaking, but you don't understand what they're saying. This may be a symptom of stroke. If any of those three happens, it's time to call 911. Right away call 911 because there's professional team. If 911 knows it's a stroke, and then it's the first 6 hours, they will send you to the specialized stroke treatment hospitals. When you go to the hospital, call 911 when you arrive at the hospital. There's a multidisciplinary team like doctors, nurses. First few days, the first day at the hospital, it will be the ICU emergency doctors and taking care of the stroke patients and nurses. At the beginning, when you're at the emergency, those would be treating the patient. We hope in the shortest period of time. In an hour, we could give the patient appropriate treatment medication to reduce the disability afterwards. If unfortunately there's a stroke, and then once one is in the hospital, there will be a team of professionals to help with rehab, doctors, nurses, physiotherapists, occupational therapists, speech language pathologists, and social workers. They all can help you. Actually, after a stroke, you not only need to know why you had a stroke, using appropriate medication to reduce the risk of the stroke, and also we hope to help the patient recover through the rehabilitation. And also, I hope that at the time of the hospitalization, it could be reduced, the complication of a stroke. What are the complications after the stroke? Maybe cardiac issues, depression, swallowing problems, unable to eat, or perhaps you lie down too long in bed. There will be bad sores. After lying in bed too long, there might be blood clots in the legs. Accumulate in the legs, causing risk to life. So coming to the hospital not only is for the support the stroke, but also to reduce the complication that may be caused by a stroke. The medication taken usually, if it's ischemic stroke, usually use anti-platelet medication, also treatment for filial fibrillation, and also usually used to reduce cholesterol, statin type of medication, and also to control blood pressure. In terms of lifestyle, not only taking medication, we hope patients would change their lifestyle to reduce having another stroke, including quitting smoking, healthy diet, less salt food, or high salt food, reduce blood pressure, less red meat. Protein is mainly in white meat, so more vegetables, fruits, and also more exercise. We want the patients to do 30 minutes a day of exercise apart from walking on level ground, and that's okay. Cut down on alcohol intake. The best is to stop drinking altogether. Sometimes maybe for celebratory reason, maybe 6 ounces in a week. 6 ounces in a week. That's a small glass. Hopefully, you will reduce another stroke through the lifestyle change. Hopefully, you will reduce another stroke risk. After a stroke, I just said earlier, there must be early rehabilitation. The earlier rehabilitation, it means a better recovery. So you can see, after being hospitalized, we hope the patient will start moving as soon as possible. And with the physiotherapists, they could do either mobility balance and also get physiotherapy as soon as possible. And also occupational therapy. So we'll look at the daily test, see whether any help is needed. Cooking or going to the washroom is a daily task. Whether the person can do that, so more training is done. Hopefully they'll regain the functions. Speech-wise, a lot of people after a stroke, maybe they are unable to speak or may not know what people are saying. So the speech language therapy sometimes is not just unable to say it, but what is said is too slurred speech or difficult pronunciation. The speech therapist could help patients to speak clearer. I said earlier, after a stroke, there's a high risk of depression or anxiety, anxious, so that needs psychological treatment. After the stroke patient, I said earlier, apart from doing physiotherapy to go according to doctor's suggestion on the diet and medication, attend rehab sessions regularly. If you are not in the hospital, when you go home, you should continue doing that. If you don't, the symptoms may recur. And I said earlier, eat healthy meals, avoid smoking and alcohol, monitor blood pressure and blood sugar and cholesterol, and also stay connected with community support groups and maintain your social life. All these would help the patient to recover, to rehabilitate. They not only affect the patient, you also affect family. Sometimes the family look at the condition of the patient. If they are staying at home, they want to help. There's an odd of recurrence, so they need to know stroke warning signs to make sure the patient is taking has got medication adherence according to the way the doctor wants. Maintain a healthy lifestyle. If if people surrounding you, if they are eating something else, sometimes it's difficult to maintain a healthy lifestyle. Do follow-up appointments, see the doctors, and family members also need to use the community and family support to help the patient recover. What I've just said in this forum, later on, there'll be some in-depth information given to you. So I'm here. That's where I am.
Thank you, Dr. Yip, for such a very detailed presentation of what stroke is, as well as very basic information. Hopefully it will help everyone, because this is a sudden onset and all the symptoms come up suddenly. So I hope everyone by now knows about this. And if someone in your family has such symptoms, then you know how to deal with it. We have a bit of time to share the experience of two elderly persons, elderly gentlemen. One gentleman is over 80 years old, and he was making breakfast as usual. Nothing happened. He was trying to put the food on the table and then sat down, but all of a sudden there was a thud. And then he fell on the floor, and the first reaction of the family members was, "How come you're so clumsy?" And they wanted to talk to him. And they realized that he was not able to speak clearly because he was slurring in his speech. And then he also felt he wanted to let us know that the left side of his body was kind of immobile, that he was not able to control his movements. Actually, he was not, actually never sat down on the chair. So under those circumstances, the family member also realized that he was salivating on the corner of his mouth. So they did not wait. They just called a family doctor and asked, and the family doctor said that call 911 for an ambulance and take him to the hospital. So he was admitted into the hospital because he lived in Richmond. First, he went to the general hospital in Richmond, and then the assessment was such that he had to be transferred to the VGH. So they took him to the VGH, and eventually he recovered. Another elderly gentleman was also over 80 years old. That morning was eating breakfast. Actually, he would read newspapers, Chinese newspapers, English newspapers, French newspapers, until he was eating his breakfast slowly. And all of a sudden, he called his son, "How come when I'm holding my newspaper, I cannot read at all? I do not recognize any of the words, whether it's Chinese, English, or Spanish. I don't understand why this is happening. It's so funny." So his family then asked him, "Are there any other parts? Do you have any discomfort? Any other discomfort?" There's nothing wrong. He just could not recognize the words when he was trying to read the newspapers. So they discussed with the family doctor, and then he was referred to a brain specialist, and I saw the specialist, and this was a minor stroke, which was diagnosed to be a minor stroke, which affected his ability to read. Nothing wrong with walking, swallowing, listening to speech, understanding speech, that just that reading. He lost all of his ability to read, so eventually he was given, he went to outpatient treatment, for outpatient treatment, and eventually he was able to read 95%. After he was trained, he could read 90% of the English and Chinese. I don't know about the other languages, but anyway, this was a very different, two different scenarios, two different kinds of symptoms. Those were also causes of stroke. So after you know that there are different symptoms, and these symptoms are all sudden onset, so you should pay attention to those. Next. Now, Dr. Yip has just talked about recovery. So, after a stroke, as I said, those two elderly gentlemen have experienced the recovery process. And today we have invited Dr. Richard Ho, who is a physiatrist or physical medicine and rehabilitation specialist. He completed his medical degree in UBC. His specialty is on exercise and sports injury and ultrasound, as well as muscle injection. Now, Dr. Ho is a new clinical doctor at UBC. In 2019, he received an award for being an excellent educator. Unfortunately, he's not able to give us his talk live today, but we have made a recording of his presentation, and through this presentation, I hope that you can understand what is rehabilitation after stroke, and the timing, the scheduling, and what members are comprised in the rehab team, and what their roles are in the rehab process, and see if the rehab process can help those patients who have had strokes. So let's hear from Dr. Ho. Thank you for inviting me to talk about rehabilitation after stroke. There are no disclosures today. After a stroke, the cells inside the brain have been affected. And since they have been injured, there are many kinds of impact. Now we have to look at which areas of the brain have been injured, because different issues may occur. Now, what kind of impacts are there? Here we have many examples. After one stroke, another stroke may occur. And there can be issues with talking or speaking, or issues with not understanding what other people say. Urination and bowel movements may also be affected, meaning incontinence. Thinking may also be affected, and memory may become poor. There may be contractures in the joints. It can also affect moods. Swallowing may be an issue, and there may be drooping of the face. The nerve pain may affect the shoulders. The nerve pain may also affect one side of the body or the hands. Now, vision and hearing may also be affected. And there may be loss of sensation on one side of the body. You may feel weak when you try to walk, or balance may be affected. If it is a serious case of stroke, there may be seizures. In summary, stroke can cause a lot of impact. If a person has had a stroke, there are a number of goals in rehabilitation to help you. First, it can help you learn how to adapt to changes after a stroke, changes to your body. Second, it will, as much as possible, help you regain your ability to move. Third, it will help you with discharge from the hospital. For example, if some kind of renovation needs to be made after you return home, they will help you with that. In cases of serious stroke, where it is unsafe to go home, then you should consider a senior's home. Fourth, rehab can hopefully prevent complications. For example, it will help you prevent slips and falls if your legs are weak, or to prevent another stroke. Now, if the stroke is minor, hopefully the body itself can recover to its normal conditions before the stroke. For moderate or serious cases of strokes, the body may not recover to its normal conditions before the stroke. When you go to rehab, your rehab team first assess your situation and the impact before they find ways to help you recover your day-to-day life skills. In a lot of cases, even after rehab, a person may not recover 100% of the normal conditions before the stroke. For example, if the legs are weak or unable to walk after a stroke, physiotherapy can train you to regain your strength. But if it was a serious case of stroke and you cannot regain your strength, your team may find ways to help you move. For example, they may prescribe crutches or a walker for you. If these do not work, they may teach you how to use a wheelchair. Another example is if a stroke has impacted your talking or speech, you can see a speech language pathologist. Sometimes they can get you some exercise to train your mouth movements, and hopefully with practice can help you gain your speech. But in serious cases, and if the above do not resolve the issues, they may find ways to help you communicate. For example, they may give you a computer and you can write with the computer or draw to communicate. In Vancouver, there are two kinds of rehab programs. The first kind is outpatient rehab. After a stroke, if your team in the hospital consider that it is safe for you to go home, then you can have outpatient rehab. This means you live at home and you go to the rehab center every day for rehab. You go home at night for dinner and sleep. In more serious cases of stroke, and if your team in the hospital think that you cannot live at home, for example, if you cannot go to the bathroom by yourself, you will have to go to inpatient rehab, which means you actually live in the rehab center. In most minor cases of stroke, where there are not too many impacts or the impacts are not too bad, you can have outpatient rehab. For moderate cases of stroke, most of them will live in the rehab center. For very serious cases of stroke where there are multiple impacts, sometimes even rehab cannot help you. There is another example. If multiple impacts occur after a stroke, including impact on the memory, or when the memory is very poor, you may not be able to learn what your team teach you at the rehab center, learn the new skills. In those situations where you cannot go home and you cannot go to the rehab center, you may need 24/7 care. Then you may have to go to a senior's home. A rehab team is made up of a number of members. The most important person is you, yourself, because when you go to rehab, you have to try hard to learn and practice new skills. The second most important component is your family, because they can give you support. In the rehab center, there are many kinds of therapists. First, you have a doctor who is a physiatrist who can prescribe medications and to prevent another stroke and, if necessary, arrange a physical examination. Second, there is a nurse who provides care for you at the rehab center and help you practice your skills. There is also an occupational therapist who can help you recover skills in your arms and hands, as well as day-to-day life skills, including putting on clothes, eating, toileting, and bathing. They can also go to your home to assess whether changes are necessary to make life easier and safer. There is also a physiotherapist who helps you with your movements. For example, walking, or teach you how to use the wheelchair or your balance. There is also a speech language pathologist or SLP who can help you regain your speech, reading out loud and swallowing. There is also a psychologist who can talk about your moods with you. There are other professionals, such as a social worker who can make arrangements for you to return home safely or where you can go after you're discharged. In summary, your rehab team can help you regain your abilities to move as much as possible and prevent complications. A rehab team may find different ways to help you regain your day-to-day life skills. They will assess your situation and impact to find ways to help you. For example, if your balance is affected, they can find ways to prevent slips and falls. Or if your muscles are too tight, if there's spasticity, they will find ways to relax your muscles. They also teach you how to prevent another stroke, which means you have to follow the doctor's orders to take medications. Your team will also teach you how to make lifestyle changes. When you go to rehab, you have to work hard, as well as try hard, to control other risk factors of stroke. For example, diabetes, atrial fibrillation, high cholesterol, or high blood pressure. Also, try hard to change bad habits. For example, if you're a smoker, meaning smoking cigarettes, okay, you should quit smoking or reduce alcohol intake or try to control your weight as much as possible. Now, in these two slides, I have included some information on stroke. You can read for yourself. Thank you. Thank you. Bye.
Thank you, Dr. Ho. Thank you for your explanation on the rehabilitation team. the gist is the patient themselves are very important because a lot of stuff need to be repeated to relearn. So try your best and be patient to practice slowly. That's a very important point. The doctor also introduce different therapies in society. We usually are more familiar with physiotherapists, not only stroke, other physical conditions you may need to help. You need help with the physiotherapists, and another one is occupational therapist. You may be in touch with them. And another one is a speech therapist. Generally, you see them not as often. A lot of stroke patients, they have a problem with unclear speech or unable to speak, or swallowing problem, at least at the beginning onset of a stroke. Many patients have that problem. If it's more severe, when the patient is in the hospital, or maybe they're able to get treatment, or when they're able to go home and this problem is not resolved, how could a speech therapist help them? Today we are happy to have Andrea Lau, registered speech pathologist, to tell us speech and swallowing rehabilitation issues. Andrea is a speech language therapist at St. Paul's Hospital. Starting in 2019, she's been providing support for stroke sufferers, including communication and swallowing. She has also worked in the medical and critical care units, helping patients and families what might be the changes that might happen after a stroke, and also promote safe swallowing, and also recovery of function. Apart from her hospital work, Andrea also is the founder of SpeechVancouver.com. Is in English, Cantonese, and Mandarin to help individual treatment, to help the sufferers, patients after their discharge. They continue with their recovery, rehabilitation. She is also has got master's degree from the hospital. Thank you, Andrea, for coming to talk about communication and swallowing rehabilitation. Thank you, Barbara. I want to make sure I can change the slides. Okay, correct. Yeah, problem solved. Okay. Hi, everyone. I am a professional speech therapist, and also I'm the founder of Vancouver SpeechVancouver.com. I want to share a few topics with you today. I want to share a few topics with you. I want to have you help you understand speech therapies, the role played by them after a stroke, and also to explore communication challenges and swallowing recovery, and also understand patients' difficulty in communication and swallowing, and also help to improve their communication and reduce the frustration. So speech therapies, how can they help with stroke and brain-injured patients? I have a few pointers. We can assess speech, language, voice, cognition, and swallowing functions. And also we can, based on the patient's goals, provide individualized therapy and plans. And we could support families and caregivers. We can also work as part of the healthcare team that will include, as you know, doctors, physiotherapists, occupational therapists, and dietitians, etc. Some patients may have swallowing problem, they might get choked or they feel the food get stuck in their throat. Actually, swallowing is an inborn ability in the humankind. This action seems simple, but actually it involves a lot of steps. When the mouth and throat and any part has got problem, then you may have swallowing problems. Usually, you can the symptoms see the speed of intake of food gets slower. You feel the food gets stuck. It's not up and down. If the symptom is more severe, the patient may be susceptible to pneumonia. In order to help patients with difficulty swallowing to eat safely, the speech therapies will do a swallowing assessment, and also according to IDTSI's national international standard, devise a personalized diet suggestions. Okay, I have several pictures. It's okay, I want to say, for instance, how we can help. We can mince food, soft food, so easier to chew, and also use a blender to puree the food. And the puree food, I want to say puree food texture, even though is different from the actual food itself, in terms of taste, may not be attractive. So a lot of patients with swallowing difficulty, so the appetite would go down, causing the weight to go down, and also malnourished. Apart from that, the social activities and life quality may be affected, because generally in the normal restaurant they may not provide appropriate food selection, so it might affect them going out to eat the selection. Speech therapists can, through training and adjustment ways of taking food and habit, help them eat safely. And you can see from the pictures and the more recent research done on the patients swallowing difficulty, using different technology and equipment to help with our assessment, and also do relevant training. For instance, we can use X-ray to see at the time of swallowing the mouth and the throat condition, and we can use a special cup to drink more safely, and also doing different posture and different exercise to strengthen the relevant muscles. Yeah, that's the pureed food. Now I want to talk about after a stroke communication difficulties. There are 4 types. I see. I want to say first is aphasia. I will talk in detail about that. What is aphasia? Aphasia usually is because of the brain is damaged, caused by brain damage. When brain damage, is because of the cranial stroke or some trauma. A lot of the aphasia is because the left brain got damaged, causing it. because our language zone is on the left. So if your left brain is damaged, it might affect our language ability. Language ability includes understanding and conveying. If the patient has problem understanding the language, sometimes they may not understand what the other person is saying, or even in more severe situation, they may continuously say a lot of things, but when people are talking to them, but they totally do not understand. So people sometimes they don't understand what other people are saying. And another thing is, in terms of conveying the message, sometimes the patient has a lot to say, but they are unable to say, or they say different words. For instance, if maybe they want to say apple, but they came out with orange. So we'll say this is misspoken language. This time they want to say apple, but they say apple, but pronounce differently. So we say enunciation problem. How could they be helped? The language language therapists could do a detailed language assessment to understand the patient's understanding and ability to convey the message. When the patient's ability is understood, the speech therapist will base on the actual communication ability and daily communication requirement and their personal interest and device and appropriate training purpose, and also do some aphasia training. Hopefully the patient could be assisted to help them understand other people better and also clearly expressing themselves. Language therapies actually, in terms of training, oftentimes they sometimes use picture cards or use computer to help these patients through the training. Maybe the doctor has said that already. When is the best time to do that training? Actually, the sooner the better. If after a stroke, if they could start the language treatment as soon as possible, the result would be more satisfactory. What is dysarthria? Because of talking, the relevant muscles weak, or sometimes it's hard to enunciate. This would affect what is said is getting more and more unclear, and also there's another one we call apraxia. This is apraxia. This means the muscles, relevant muscles, are normal in function, but it's hard to effectively control. So it affects when it comes to speaking, the sound and the oral movement, and the plan and the coordination ability. How could the speech therapist help? Where we would practice how to use a proper mouth shape, and also rhythm, and try to practice slowly speak it. No need to get impatient. And the fourth type communication difficulties after a stroke. That's a cognitive communication disorder. There are 5 points. What are they? Memory difficulty, difficult learning new information or retrieving old information. Perhaps attention challenges and dealing with information may be slower. And also in terms of understanding abstract ideas, problem solving, referencing, there might be difficulties. In terms of oneself's merits and deficits that may be reduced. So as a speech therapist, how could we help? Usually we would work with occupational therapists. We would implement new plans, new strategy to deal with cognitive disorder. So
if the patient has difficulty to express himself or herself, it can affect their mood because when they try to express themselves and they are unable to do that, then it creates communication problems. And so I want to talk to you about this. Remember, so I use a filing cabinet to describe the information inside. Okay, they may be disorganized, but all the information is still there. So it may take a little bit of time initially to take out the information, and together with the therapist, they can practice new technique, new strategies to store information and to reorganize the information. I want to give you 4 tips how to support communication with someone who has had a stroke, especially when difficulties arise in terms of expressing oneself. Now, first, you can use other ways to communicate, such as gestures, pointing at pictures, drawing or writing, or using whatever is available in the environment as reminders. Second, we can try to find out their degree of understanding so we can verify and clarify. And remember, during the process of communication, we have to write out the key words and just the important information, just the key words. And if you want to learn more about how to help those who have difficulty expressing themselves verbally, here there are some resources, some graphics. First of all, there is the Aphasia Institute, aphasia.ca. They have free information for even children and grandchildren and for family to communicate with someone who has aphasia. If the patient has difficulty comprehending speech, there are ways we can help. First, we can create an appropriate environment. For example, reduce background noise to ensure there is proper lighting so that we can communicate with each other. And finally, this is very important. We have to remember, we have to respect that person's ability to understand and articulate. So how can we communicate directly with someone who has aphasia? So we have to speak in a normal tone of voice. We have to remind him or her that I know you know what I mean. So hopefully that can encourage that person. So that ends my presentation. I want to encourage everyone, those who have suffered a stroke, that through the help of speech, the language pathologists, that they can regain their speech. Try hard. Don't give up. Thank you, Andrea, for having given us so much information about what a speech language pathologist does. It's a very deep science, right? So we have all kinds of training. So don't ever lose your confidence, okay? So slowly follow the therapist's advice and practice hard at home. Thank you again, Andrea. After a stroke, because the brain has been injured, so psychological issues may arise because a person cannot talk, cannot move, and is irritable. So because the area of where the stroke occurred also affects that person psychologically. And it not only causes physical problems, but it can also create issues in terms of mood and cognitive abilities. Today we have invited psychologist Dr. Tigerson Young to talk about how to rebuild oneself after a stroke psychologically. Dr. Young, if you have joined us in previous fora, you must have seen Dr. Young, because Dr. Young is a very famous person who he works full-time as a psychologist in UBC, Kwantlen Polytechnic, and Thompson River. So every month he hosts a program on Chinese radio. Welcome, Dr. Yang. Happy to see you again, and thank you for taking time again to talk about rebuilding oneself after stroke. You have the mic now. How is everyone? Can you see me? Can you hear me? Perfect. So first, should I share my slides with you guys? Yes, if that is so, fine. Give me a moment so that I can share them with you. Thank you, iCON, for again inviting me, for giving me this opportunity to share with you. We have a fantastic topic today, and thank you for those who are joining us at home for this opportunity. Let me see if I can share the screen with you, the slides. If I can't do that, I will have to pass the ball back to Barbara's court. I can't move my slides. Well, anyway, we're going to talk for about 20 minutes. 20 minutes. So we can talk about 3 different topics regarding rebuilding oneself. We can explore how a person himself or herself changes in terms of her identity. And then we can also explore psychological interventions for stroke survivors. And third, we can, from a psychological perspective, to explore how to prevent stroke. So if you have specific questions, okay, use the chat function and leave us a message or a question. See if we can respond to that afterwards, okay? Now, let's jump to the slide where it talks about identity changes after a stroke. Now, after a stroke, what kinds of changes are there in identity? So we have heard about a lot of information. We have a lot of information in terms of our physical functions. Now, actually, a stroke can also affect our mood and also our identity ability. So how do you identify yourself after a stroke? For example, maybe we use our profession to represent our identity. I'm an engineer, I'm an interpreter, and I'm a professional athlete, all of that. So all of those. And you can also use other ways to identify yourself. Like, I'm a Canadian, I'm a half Indian, East Indian, or I'm a 100% Chinese. So you can use other ways to identify yourself. For example, I am Linda's husband, or I am Wei Zhong's cousin. So you can use many kinds of identities. So before a stroke, most of us has already had a certain identity of oneself. A lot of research has found that after a stroke, these identities actually there are many changes in those. Now, before, many people just took it for granted, and then all of a sudden, overnight, it changed. Now, in 2024, there was a research in the United Kingdom. So there were 14 women and 16 men who were interviewed, not a big research. So they talked about what happened after a stroke, their experiences after a stroke. This research found that after a stroke, actually there was a certain period of time in which they were ambiguous. Ambiguous meaning that this was what we call a liminality. So this was a very difficult period for a stroke survivor. And you can understand that, of course, because after a stroke, initially, at least, all of a sudden, all of these take for granted identities, all of these roles which one had taken for granted before, they changed drastically. So that was so unexpected. They caught us by surprise. It was a period of time where our identities all of a sudden changed so differently, so drastically different, so uncertain. So before, okay, we could do these things, many things, okay, we could still do them, but some we could not do. For example, if we're trying to speak a sentence, we express it so differently. So research found that this liminality, this ambiguous stage, has a decisive factor, is a decisive stage for the stroke survivor. No, I think there are many factors. For example,
before a stroke and after a stroke and dealing with it, it also affect the recovery process after a stroke. One of the effects is you can often see, because the vulnerability in terms of life, there's a very deep appreciation. Perhaps before that you didn't think that life could be so vulnerable. All of a sudden, with the experience of a stroke, the perception of life may change very drastically, and a stroke patient may also have feel that self-insufficiency when they compare the identity of self before a stroke or compare with other people. They make us think that the self-insufficiency is stronger after a stroke. Self-identity rebuild may be more challenging. Also, maybe it's a more long-term process. The rehabilitation effect may be affected by different factors. In this research, it is found that you have to help stroke patients to arrange the aims and beliefs and social relationship, and also the dialogue in life. When you rearrange after self-identity after a stroke compared to before a stroke, maybe after a stroke, maybe you need to rely on other people to help with a lot of some items in your life. I could do that before, I couldn't do that. Now I have to get help from other people. To the stroke patient, it may mean that I have lost some independent living ability, self-management ability. So to the stroke patient, and also this affirmation, the identity affirmation, maybe it will have a very serious effect. So it would make us feel that maybe we would feel helpless, very defeated sense. So the stroke patient, maybe before a stroke and after a stroke, the self-identity and maybe there's a disconnect, so that you will have a crisis in identity. So this crisis may make us the life after stroke cause some hindrance. And okay, we'll look at the next one. The research also found that when the stroke patient is ignored or is on the fringe, the rehabilitation is getting more difficult, especially in the initial liminality. A lot of the stroke patients may ask, why me? Why it happened to me, right? So apart feeling is a very unfortunate thing. Sometimes they may think that, like we just mentioned, self-insufficiency, maybe I did something wrong. So maybe before I did something, we blame ourselves. This self-insufficiency make us all fringed, being on the fringe, being ignored. And this self-stigmatization will make more hindrance in terms of rehabilitation, becomes a vicious cycle. I forgot to tell you to bring the next one. Next one, please. So if the factors like these from the initial infant liminality becomes a long-term liminality, then the rehabilitation process and speed will be affected more severely. The stroke patient will be more and more. The self and reality will have more distance. The self-stigmatization would be more severe, making the stroke patient more isolated, like we have said, becomes a vicious cycle. Okay, next slide, please. How do we help stroke patient to rebuild their identity, reconfigure their value? We see whether we can focus on a few things. First, how to help some stroke patients to accept the present situation. Okay, what I can't change the past, I can't control the future, but what can I control the present? How to help the stroke patients with their need to pre-evaluate priorities. Thirdly, how to help stroke patients to rebuild meaning in life. What I could do in the past, now I can't. Sometimes my life meaning may be changed, especially maybe in the past, my occupation, I could do certain things, my identity, but now there's a change identity. I have to look for a new meaning. Fourth, use different dialogue to describe our identity, to describe the process of the disease. You don't have to blame yourself. It's my fault. I did something wrong. If we can change that dialogue, maybe that vicious cycle will not be so severe. So next one, please. Some of the factors will help the rehabilitation, and some factors will hinder the rehabilitation. The rehabilitation that's helpful is help the stroke patient, the relative, the friends support. If we can do self-centered care, more comprehensive, more holistic care to care for the patient in terms of all the different needs in different areas, maybe is very helpful. On the other hand, if the stroke patient has this stigmatization and also fragmented care, then it would also cause a lot of hindrance to the rehabilitation process. Next one. In other words, stroke patients, apart from having the physical function and the need when we care for them, if we can also add some additional support, maybe it'd be helpful. For instance, how to help them to rebuild their self, and how to help them long-term and more holistic care, and also how to listen to the stroke patient, their life stories, how they had this stroke. So perhaps in that case, it might be affect the quality of the rehabilitation. So next one, please. After a stroke, one of the more common resources that we saw, like this morning, we heard many exercise, physical therapists, speech therapists, occupational therapists, etc. So if you could go adhere to the directions, of course, all this would be helpful. Next one. Apart from the physical function and rehabilitation, the psychological treatment of the stroke patient is very important. In 2023 report included 30 stroke patients. The stroke time from 1 second to 5. It found that the self-identity reconstruction for the rehabilitation has a very important role. Next one, please. So in terms of psychological treatment, in the process of doing that, we realized a few factors. Perhaps it may be to the stroke patient is cause some hindrance. First, a lot of the patients, they think they are judged by others. You are not done enough. It's not good. It doesn't mean that other people are really judging them, but this is a very common psychological reaction. So we have to remember, when a stroke patient, when the friend has got this reaction, when they think like that, perhaps is like after a stroke, like maybe is some effect on the brain, is effect on the mood, and so that they have this reaction. So it's not uncommon. It's not odd. This is not uncommon. Some of the symptoms may not be obvious. So, for instance, a patient, in terms of the degree of the stroke, maybe is more minor, but the rehabilitation may be more ideal. But then there's still different from what they expected. So this may not be obvious to other people. for instance, using of their limbs and also the way they speak, the speed and the clarity. So this unclear symptom, sometimes it would bring about some misunderstanding. Other people might feel that maybe this is deliberate. There's no reason for you to not be able to do that. You could do other things. Why not do this? So maybe there's some conflict caused. Thirdly, in the process of rehabilitation, a lot of the patients feel very isolated. There's some disconnect with the outside world. It's a vicious cycle. When you have a stroke, we feel resistant to the outside world. We don't want to go out. We don't want to talk to other people. We don't want to be seen by other people. The present physical situation. So when things like that happen, is again another vicious cycle. One gets more isolated and more distant from the outside world. Also, fourthly, the stroke patient may lose some meaningful role, our occupation, our identity, our other history, etc. Fifthly, stroke patients, many times, they don't like to become one that is reliant on other people in life. When we feel like that, we feel that more vulnerable. We feel that it's like we are debased. So when it comes to taking care of stroke patient, if we can be more understanding of the difficulty of all these factors, then we may be able, taking care of stroke patients, we may be more effective. Next slide, please. When we have to take care of a stroke patient, we can try the following strategy and see if they work. First, we can try to encourage the patient and the family and the friends and other professional people to have more in-depth and all dialect. Sometimes we just say, we ask whether you have any function change. Sometimes other speakers say stroke doesn't affect our intelligence. Doesn't mean that when I have a stroke, my intelligence drops. So maybe we can have a more meaningful, more in-depth discussion, and not just say that, oh, what have you eaten, what have you done. And we can also try to encourage the stroke patient to reframe their story, to reinterpret their process, not that they have done something wrong or they did something different. If we can reframe this dialogue, it may be more helpful in terms of the process of rehabilitation. We can also help stroke patients to regain their agency. Even though after a stroke, we may not be able to do a lot of stuff, doesn't mean that I can't do anything, right? So if we can help some stroke patient to find new agency, then we may be able to think that to make them not feel so helpless, so useless. So we can try to help the stroke patient to set new goals to regain agency. Fifthly, we can we have to learn how to listen to the stroke patients so that they will feel they're accepted, they're understood. It's not that I have to help them to solve problems, right? Just like sometimes the stroke patient, they just need us to accept them and listen to them, so we can use a different method. Next one, please.
So even though you don't need to care for someone who has had a stroke, but as a family member, there are many other things that you can still do. We can try to accept it. okay, accept the moods of someone who has had a stroke, because sometimes they cannot control it. It's not like they do it on purpose. We can also try to respect and not be judgmental, to interact, to talk with someone who has had a stroke. We should also respect their abilities, their current, and not focus on their limitations. We can also encourage them to participate in the decision-making process, because they can still make decisions. So it's not like, oh, this person has had a stroke, not very fluent in speech and not very mobile. So we still have to give that person an opportunity to take part in the decision-making process. We can also use some way to talk about the future, the near future, not like 5 years from now, 10 years from now. We just want to talk about between now and the next few moments. We can try to focus on listening, not to rectify, not to correct their speech, their stories, okay? Sometimes we just have to listen. Next one. Now, in terms of psychological treatment, so one of the strategies we use is what we call a dyadic coping. Now, in this process, we can hope to encourage the person to participate more in social activities. So if you are a spouse of someone who has had a stroke, this is a very important role that you're going to have to play. So, especially the ones that that person loves, you can encourage them to take part in social activities, and also through our intervention, we can hope to change or improve their technique when they communicate with their spouse or family members. And again, take a more active role in community activities. We can use different strategies. Speech is just one of the strategies, because communication is more than just speech. Non-speaking part, for example, facial expressions, gestures, drawings, graphics. So using these dyadic communicative skills, then they can learn new strategies. Next one, please. So in this dyadic intervention, it includes daily living skills, communication between the two people, how to manage their strategies, how the family play their role, either indoors or in other activities, and gradually they can address the skills and how to deal with pressure, and then they can then expand that to outdoor activities. For sure, the ultimate objective is for the person who has had a stroke to come back, to reintegrate into social life. So other than these psychological and interpersonal therapies, now we can also use other alternative treatments, for example, music therapy, to improve their moods. Now, moods can comprise depression, anxiety, and other symptoms. So what good does music therapy do? After a stroke, many patients, in addition to injuries physiologically, in terms of their mood, they have also suffered. Now, if a patient has anxiety or depressive symptoms, So it can affect at least 30 to 35% of the survivors. So music therapy is a non-intervention kind of therapy, or non-invasive kind of therapy. So music therapies can also coordinate with other therapies like Tai Chi or 把段锦 and other kinds of therapies. So, and then I know I only have 3 minutes left. So, other than therapies, of course, we want to prevent another stroke because psychologically it's very important to have the right mindset to prevent stroke. So there's a research done which covered 48 studies, and actually here it says 57,000 patients, and the findings were that many times there were complications like depression and anxiety after a stroke, and the research also told us that early intervention, how important that plays a role for the patient. Now, from another perspective, mental health is also important. For example, it can be a protective measure. And in the next line, we skip this one. This is the last one, okay? Okay, let's be quick. Get to the last one. Exactly. Now, let me put it this way. So there are many research projects which find that there are very negative impact on a person's mindset. So, but being an optimist has positive effects. Now, for example, we're not certain from our research whether those who have had a stroke, what are the exact statistics, but depending on how you look at it, if you want me to bet on a roulette, so I will bet on the red part, the optimistic part, so that we can prevent these cardiovascular complications. Now, family members, what can family members do? Now, in the recovery process, as a friend, as a family member, you can try to praise them, okay? Praise them. Even a little bit of praise is still good, okay? We also have to schedule an exercise program, but make sure that the place to do exercise is safe. We can ask the staff, what about those home exercise? How do you do them? And then you have to give yourself a treat after you've done one session of exercise so that you can make faster progress. Yeah. So again, thank you, iCON, for again giving me this opportunity to share with you my information, and hope that 2026 brings a new year, a year of better health, especially for those who have had suffer from a stroke, and then they can recover more quickly and better. Thank you. Thank you, Dr. Yang, for such detailed information and analysis on the psychological impact on the patient and on the family members, and what kind of tips you had given us for the patient to recover. Now, let's come back to this. Now, none of us knows what lies ahead tomorrow. So let's just think, one day, all of a sudden, you've lost your ability to speak because of a serious illness, or because of a stroke, or because of an accident, or because of some sudden relapse of chronic illness. So we cannot control our speech. We cannot talk. What kind of people know what our wishes are. Simply put, when you talk about eating or paying the bills, who's going to buy groceries for us? Who's going to pay the rent for us? Now, you cannot express that to your family members or your friends. So what can you do? How can you plan ahead? Thank you, Barbara. How can you plan ahead? So our next speaker is Patsy Lam, who is a registered nurse, and she is also very perceptive in this. Thank you, Patsy. Can you hear me well, Barbara? Yes? Thank you. So please advance the slides for me, Anna. Thank you. Now, how's everyone? First, I want to introduce myself. I'm Patsy Lam. I'm a registered nurse. I've worked for more than 20 years in BC. I want to thank Barbara and Minika for inviting me to talk about what advanced planning is. In this session, we're going to talk about a few topics. One is advanced planning, and after that, we'll talk about palliative care, and lastly, we can give you some idea of what kind of resources are there in the community. First of all, now, advanced care planning. There are many kinds of ways to translate that into another language. So advanced care planning, simply put, is ACP. Now, ACP has been highly recommended by many health boards. So what is ACP? Advanced care planning is something that you can consider ahead of time, to make arrangements ahead of time, because like Barbara said, that life is full of unexpected events. So if someone unforeseen happens, advanced care planning can help your medical team, and as well as your decision maker can help you make decisions. So here it says it is something that is actually a time to reflect on your values and wishes. So when we think about medical planning, for example, maybe putting a tube in me or feeding me. So when you think of something so detailed, it's very difficult to predict. So advanced care planning is important because it tells us what to do when this and that happens. So it helps us to make medical decisions. So ACP is not one single event, it's a process. There are many steps that one has to take, and depends on a person's health conditions or their changes in their value system and all that. So we have to go back to what has been planned a few years before, and maybe it's not suitable anymore. So in the next slide, you can see here that like in life, we have to plan all the time, all kinds of plans from a child. Okay, we also plan for our child, the schooling, education, and then after a child grows up, getting married, buying a property. So not just medically or individually, there are many aspects. Next line. So advanced care planning, like I said before, it's not a single event, it's a process. Sorry, I misspoke. Well, I didn't misspeak in English. It is not just a single event. So it's something you have to think about. You have to think about your personal values and what matters to you. For example, for me, interacting with people is important, or my religious beliefs are important.
Hopefully, there's a process, a pastor or religious person to support me. The second step is to learn about your health condition and how you like to take information. What health problem do I have? Will it continue? Will it deteriorate? How do I receive information? Do I want my family to be with me when I listen to the doctor? Some people will say, I don't want to know anything. Just tell my wife. Different people have different ways of doing. Just that you need to know what to do in order to communicate. The third step is decide when you're able to express your will, who will speak for you to make decision. So you have to find a decision maker, an agent. The person should not have any conflict, and the person will have more contact with you. And this person must agree to be your decision representative. And in BC, there's some law. They list a list of people that could be your decision maker. You may not want to go according to the list. I have a special one representing me. So advanced planning is very important in different forms to be signed first so that they could be used in the future. The first step is to talk, to discuss important people, to discuss priorities. And the fifth is to record, to say the important things that I have said, to record it on paper by video or audio. Next slide. In BC, you can see there's a link, there's a publication called My Voice. It has different versions, including in Chinese. This publication may be downloaded, maybe 50, 60 pages. It has got different advanced planning information and with a very detailed explanation as to what to do. And then there's some blank space for you to write down. As you read, you can think of what comes to mind. You can write down, and you can go to the website and download it. Next slide. Some people say, oh, the publication is very thick. 50, 60 pages is a simpler one. There's a workbook called Advanced Planning, several pages. This is a simplified version. It aims to help people with stroke or with brain injury or people with limited English literacy. I read this. I think it's a very simple and easy to understand, and you can uniform your thinking and do your planning. The next slide. And very simply, I'll talk to you about palliative care. Now I want to tell you what is palliative care. Palliative care is like advanced planning. Is sometimes we interpret it as different, using different Chinese terms, but actually it's all palliative care. What is palliative care? Palliative care is a specialized medical care service. It's not a place. It is a service. It can be provided in the hospital or the patient's home or hospice or assisted living or seniors home, long-term care. The service is aimed to help people with limited life to increase their quality applicable to any age, any race, any religion. People can all access this service. The service is based on the patient's requirement. It will help them with symptom management, also support for the patient's family. Some people may decide to stay at home to get palliative care, and they don't want to go in and out of the hospital. So the home health also will send people to the person's home to support their needs. The patient may have a special requirement in terms of spiritual or religion or culturally. They may need more help. They will get support from the palliative team. In the community, there's a palliative care in the community with the nurses. They will provide this palliative care support. Next slide. And then people may ask, how do I arrange for a palliative care service? If you are interested, you need to. People who require this palliative care, you can contact your health authority. You can see there are several telephone numbers based on the patient's address. You can call the relevant number. You can get the medical professional people like your family doctor and specialist to help you make a referral. Next slide. In BC, there's a BC Palliative Care Benefits Program. This subsidy program is applicable to BC resident with active MSP coverage and people who have reached the end stage of life-threatening disease wish to receive palliative care. There's a form that has to be filled in by the patient, the family, and the doctor. Once approved, when it's found eligible, they can obtain the 100% of the prescribed medication. Not everybody gets coverage. The medication in the palliative benefits program, medication will get 100% coverage. Also, the medical equipment and supplies will be covered. Not all. If you need to know what will be covered, you can go to their website to make inquiries. Next slide. Very simple. I told you what is palliative care. I give you some information about this service. There are 3 links. The first is Advanced Care Plan Information Booklet. Is provided by the palliative care, meaning the third one. Actually, it's a website that provide many palliative care support information, including information on the planning. You can go to a website. This advanced planning booklet has got 20-odd pages. It is in Chinese and many other languages. More information, more understanding. Hopefully you get. If I want to know more about palliative care or specifically what service my home health authority provides, there's a homepage, Vancouver Coastal Health. If you're in other health authority, you can go to the health authority that's in charge of your area. You can enter the relevant name of the health authority. Palliative care service provided by each may be different. Meaning how to call in to get your service. You can go to the website to make inquiries. Next slide. The last page is the BC Health Link BC. This is a telephone number every day, 24 hours a day. It can provide the health information every day. The last one is the Family Caregivers of BC. This website provides information to caregivers like when they have workshops or expos, so caregivers could get more information online. That's the last slide. Thank you, Barbara. Thank you, Patsy, to explain to us the services and also advanced care planning you can stop, pause, and think to see if you need to do any advance arrangement, or if you want to know more about this information, you can go to your home health authority to make inquiries. Okay. Today, we are fortunate to have so many professionals to talk to us about strokes and the effect and how they need to rehabilitate. Now we are glad to have a caregiver. He's at home now caring for his wife. In September, unfortunately, she had a stroke, and this person is Pepin Wong. He is a retired RCMP officer. Thank you, Pepin, for being interviewed by us and have a discussion with us to share your experience as a caregiver. Thank you, Barbara. I don't know if you can hear me clearly. Very clear, yes. I have to thank iCON's invitation to share. Very simply, you don't know me, about my background, about what happened. Let me have a couple of minutes to tell you what happened. And I hope all the audience wish you a Happy New Year. In the stroke process and my personal experience in the past Christmas, it was different because my wife had a stroke in September. I clearly remember that evening was very sudden. She had her bath and she came out and she changed. She said, I got a very bad headache and kept vomiting. I helped her to bed. I wanted to get her some warm water to let her rest. But very soon she lost her consciousness, no more reaction. So I was in this very panicky situation. I use clear her airway and I called 911 for help. The professional came, medic came quickly. They drove my wife to Surrey Chinese Memorial Hospital. The leader told me it was dangerous, very complicated. If anything happens, what do you want us to do? When I heard it, I was shocked. My wife had enjoyed good health, and she wasn't that old. She was in her 60s. So I said, you try your best to save her. So the team members understood. They brought her to the hospital. I went in the same ambulance. I sat in there. Apart from being nervous and shocked, because of my religious belief, I kept praying. The male driver knew that knew my situation and kept encouraging me. But after a while, the fear service, why did it happen like this? Because of this, my wife is unable to be saved. But I've been married for 7 years. What should I do?
Other than those issues, because there was religious support, so I was able to compose myself, and I also told my daughter and son-in-law I told them to contact me at the emergency ward, And when we were at the emergency ward, she was diagnosed of having had a stroke. So she was transferred to the Royal Columbian Hospital, and then she had a surgery on the next day. It seemed like the area of the stroke was on the left side of her brain, inside the brain. So she was unconscious for 14 days in the ICU, which got me very worried. So I had a lot of mental struggles, like what if she would not recover? She would become a vegetable. So because I had a friend who had the same experience in Toronto, so even after she recovers, her quality of life will drastically lower, and she may consider suicide too. Should we have arranged for these resuscitation process? Well, we went that way because we have religious beliefs. But after she came to, after 14 days, she so we have support from the church members. We also had a professional team who kept encouraging us and explaining things to us. For example, iCON, there was a professional team who supported us. So now Esther can stand on her own, and then she has regained her life, for which I'm very grateful. But I was just thinking to myself, during the recovery process, there was a lot of time that, because after she was unconscious for those 14 days, 24/7, at least 16 hours a day, I was with her. I was on her bedside. I was by her bedside. So my physical strength could not support me for that long. So not long ago, I had kidney stones. So fortunately, I had a surgery, and now I have recovered. And so in these events, over a short period of three months, it was a bit of a trial and tribulation. So thank you for the platform that we have here. We can share our experiences, and Barbara, you will send us some questions, or shall I directly answer them? We will broadcast those questions. Thank you, Pepin, for sharing the experience, because it happened so suddenly. So you were just perplexed. The family members didn't know what to do, and then you then thought about what was going to happen afterwards. So just like what you said, even in the ambulance, you were already thinking, what will happen? What should I do? Something I did wrong? Something I didn't do enough? So there were all these psychological inner struggles you had in mind. So let me ask you, now your family has, now that a family member has had a stroke, what kind of changes have you undergone? So drastic changes, because it was unexpected. So if something like that should happen, first of all, you should consider the caregivers' physical and mental health, because whether it's your spouse or your children or anyone cannot support you for that long. I mean, maximum 18 months. After 18 months, you're going to collapse. So within those 3 months, I experienced physical changes myself. So accept any kind of support, any kind of help, and even take the initiative to ask people for help. And I appreciated the medical team who gave us all these valuable opinions, and some home caregiver. I think there's a government program. There's a mechanism. Yeah, there's this kind of service. You can have 30 hours of homemaker. Of course, you have to pay for it. But so I have signed a contract with a homemaker who comes to help me, and that has been very helpful. And also, it has also helped your day-to-day routine so that you and your wife can have time to focus on the recovery, on your plan of recovery, or what else you have to do on the road to recovery, and also adequate rest and not having to worry about every single detail in your day-to-day life. And so what kind of people did you contact in order to find out that there were such services available? Yes, during the hospital. The hospital has arranged for some a care center for 3 weeks of therapy. It was very effective. Obviously, it helped my wife. And afterwards, we came home. I think only 3 weeks earlier we had gone home, and the rehab center at Surrey also contacted us, and she started going to outpatient therapy. Yeah, so she started that with also speech language therapy. Yeah, right, speech language pathologist. Yeah, so we don't have a lot of medical knowledge, but so I'm very thankful for the help from many professional caregivers. At least they helped me and my wife to go to rehab. So it has been very helpful. So don't ever lose any opportunity. Don't ever give up. So yeah, we want to encourage everyone because there are all kinds of organizations, all kinds of services that can help the patients and their family members. Now, as a caregiver, this is a second question. What has been the most challenging part? And how did you cope with that? Well, like I said, we had I had a lot of fear, and then Dr. Young has explained just now. I mean, you have to understand yourself, understand yourself more, so that you can also help the patient, so that both of you can face life together, face reality together. Finally, are there any suggestions, or do you have any kind of encouragement for other caregivers? After what I've experienced, thinking back, you have to be confident. So you have to be confident. So religious beliefs helped me a lot, gave me a lot of support. Also through religious organizations, it gave me a concrete care. I'll give you an example. During her time of hospitalization, we had what we call tender loving care meals, which helped us a lot. Thank you for taking your time to share your experience today and instill more confidence for those people who are caring for their family members or friends who have survived a stroke. All of those, everything. There's always hope in life, in the community, in the hospital. There's a lot of support, lots of help. And if you need it, don't be afraid to reach out and ask. The more you ask, the more you will know about yourself, what kind of services there are to help you, so that you can feel comfortable to get treatment at home and rest. So thank you again, Pepin, for coming here personally to share with us your experience. I hope that Auntie Esther can recover very soon. Godspeed. Thank you. Thank you for your participation too, members of the audience. Thank you. Now, this is the last segment. It's about social resources in the community. We know that TransLink itself has very good community resources to help us, not just those who have had a stroke, but also those who have chronic diseases, seniors. They can also use these services. We're happy to have Manager of Travel, Training and Public Affairs at TransLink, Mr. Christopher Chan, to tell us something about related resources for management of stroke from TransLink. Mr. Chan, like I said, is currently Manager of Travel, Training and Public Affairs at TransLink. Before that, he was he was head of the new immigrants transport and services. So he has devoted himself to sharing public transport information with community members so that they know more about what's available in public transport. Thank you, Christopher, for taking your time and sharing with us what kind of resources there are available. Hi, Barbara. Hi, everyone. Thank you for inviting me to talk about how in the community, what kind of supporting services there are in the community. Mainly, I will talk about transport, or transit, okay, in the Greater Vancouver area. And after that, Barbara will talk about what other services are available in the community. Barbara, next slide, please. I will talk first about what services are offered by TransLink. I believe most of you have heard of HandyDart. You may not know what HandyDart is, but you should have heard of it. HandyDart, what an animal, what kind of animal it is. Well, now, somebody call it HandyDart, another people call it bus for the handicapped. Now, this is a service offered by TransLink, catered to those who have disabilities, who are handicapped. So they offer transport. Now, so this is a shared transport. It's like just any bus. It's not like you own the bus. You're the exclusive passenger, but it offers a point-to-point service. Many people may have some misconceptions about HandyDart, so I want to talk about those. Now, many people may think that HandyDart, or I can only use HandyDart. I cannot use other means of public transport. In fact, you can use HandyDart to link to bus or SkyTrain or SeaBus. So if you live kind of far from a SkyTrain station, you can use HandyDart to take you there to the SkyTrain station. Another misconception is HandyDart is only for seeing doctors, for going outpatient, for medical uses. No, in fact, if you apply for HandyDart, register for HandyDart, you can use it to buy groceries, to have dim sum, to even watch Chinese operas. You can take HandyDart to those activities, as long as you have made an appointment beforehand or a booking beforehand. If you want to register or apply for HandyDart, now what kind of people are eligible? Now, some people have misconception about it. Many people think that only elders can do that.
A lot of times in the community, some senior people tell me, I'm 65, can I apply for HandyDart? actually is got nothing to do with your age. Handy-Dart's users because of your physical or cognitive difficulty and you're not able to use common transportation vehicles that makes you eligible to apply for Handy-Dart. And the application itself, he has to be confirmed by your doctor or medical professional to confirm your eligibility. Handy-Dart users may be able to apply for a handy card. Handy card is a photo identity card, and this card could let you use translate with extra help. Next slide. If you want to apply for a Handy-Dart, there's two ways to do it simply. One, you go online to get the application form, or you can call to our customer service 604-953-3680. You can call. If you don't know English, it doesn't matter. Once it's connected, you can tell them Chinese, please. They will get an interpreter to communicate with you. When filling the application form, you know that the form is for Handy-Dart and Handy Card. You can apply for both, or you may just need to apply for one. But you must remember, if you apply for Handy Card, you don't need to take a picture. If you look at the monitor on the right, there's an application form. There's a picture-like thing. If you're just applying for Handy-Dart, you don't need that. If you want to apply for a Handy Card, then you would need a photo, but you don't need to go to the store to pay for the picture. You just need your cell phone or get a friend to take a picture and email it to us. That will be fine. Handy Card is for BC residents with disability that would enable them to some extra help when they take public transport. Next slide. Handy-Dart has different types of trips. Most of the passengers would use what we call casual trips. Casual trips, you still need to pre-book, but it's not like you have to make the trip every week at a fixed hour. Like today you might use it for dim sum, or next day you have to go. Next day you're visiting your grandchildren. You must have time limit to do certain thing at a different time. If you call to pre-book the service, you can call a week in advance or at least a day before to pre-book the service. But if you have some trips that you need to do most of the time, or you have to do it at a regulated time every week, if you in 3 weeks on the same day of the week at the same time you need to go to a certain place, maybe you can apply for subscription trips. Those trips has got firm time. For instance, if you every week at the same time you need to go for a follow-up, or at the same time you need to go to the community center for a certain thing, after a few months you could pre-schedule every Monday at this time I must go. So then they will, every Monday apart from stat holiday, they will help you schedule that trip. Next slide, please. Booking your trip. We said earlier, Earliest you can do it 7 days before or up to a day before. Actually, 365 days a year you can call to make a reservation. But of course, the work hours may be different. Handy also provides service 365 days a year. The earliest is scheduling for 6 a.m. The latest, last week, it was 12 a.m. But good news, from this week on, TransLink will provide longer handy service. Starting from this week, you can schedule the last drop-off to destination at 2 a.m. If you want to pre-schedule, first you have to apply. After making your application, you can call 604-575-6600 to request a trip, or you call this number to change your trip. Next slide, please. Booking your trip, what do you need? You have to have your name ready, if possible, your handy identification number, what date you need the ride, what time, and pick up and drop off addresses. And you have to make some allowance for time because we usually, for the scheduled trips, perhaps 15 minutes before or 15 minutes after, within that half an hour, so the bus may come. So the best time is not to tell them what you would like them to pick you up at what time. You have to tell them what time I have to be arriving at this location. Then our booking agent, our representative, will try to calculate for you how much time you need to make allowance for and the booking window, so you can ensure you can go to the place that you want to go. Next slide, please. Booking your trip, I said earlier, you have to provide some information. For instance, when the bus is at your home, how do you get into the vehicle, how to inform you, especially for those people who live in apartments and high-rise is important because a lot of people misunderstand that we provide a door-to-door service, but our bus drivers, they cannot go into your building, walk to the front of your unit to pick you up. We have to wait at the front entrance of the building. So if you schedule a trip, especially if you live in a high-rise, actually you don't wait in your home. You have to wait in the lobby for us. Also, you have to tell us whether you need any walkers or wheelchair so that we can make room for you. And if you have a caregiver accompanying you or a friend going with you, you have to let us know because we have to make space, reserve a space for them. Next slide, please. Also, on the day of your trip, they will have phone calls to remind you of the pre-scheduled trips. The day before your trip, in the afternoon to evening, there will be an automated phone call to remind you that you have a handy trip booked for the next day. Approximately what time they will be at your entrance or the place that you designate. There's a reminder to remind you that next day you have a pre-scheduled trip. Next slide. On the day itself, handy would be 10 minutes before arriving at the place to pick you up, to make a phone call to remind you. If within that half an hour, maybe you are doing some other things, but before the vehicle arrives, we will make a phone call to remind you to get ready to leave so that you have more time to get ready. But actually, you should try your best to be ready within that half an hour so that you could leave, because the bus may be 15 minutes earlier than your scheduled time arrive at your place. Next slide. And I just said earlier, when you're getting ready to go to the vehicle 15 minutes before the scheduled time, the driver would use different means to get a hold of you. Sometimes maybe there's delay. If there's delay, if it's 15 minutes after your scheduled time, you still don't see the driver, you can call 604-575-6660 to make inquiries. You can also make this phone number if there's some sudden change. You could call to inform us. The earlier that you call to inform us, the better. Next slide, please. Actually, we have a guidebook. Each person applying for a handy once they are permitted, they will receive a package. There's a guidebook and your number. If you apply for a handy card, they will send you the handy card so you can understand our service in detail. So if you have any problem or question, you can go to our website or call our customer service number and ask us questions. What I would like to say today, that's all for today. Thank you, everybody, for giving me the precious time to share Translate and Handy Dot service. I'll hand it back to Barbara. Thank you, Chris, to taking time to let us tell us about Handy Dot service. I'm sure many people would be benefiting from it. You can ask your doctor whether you are eligible to apply. There's a community service you can see on the monitor. The family caregivers are busy. A couple of speakers had mentioned this service. Family caregivers are busy is through workshop and the support group. They provide some free resources support to caregivers. You have the website and also the telephone number. Next. And then today, because we're talking about stroke, also there's a Heart and Stroke Foundation in the community. They provide multilingual healthy tips for prevention and recovery. Your Stroke Journey book. It provides critical recovery information to guide you and help you guide you and your family after a stroke. There's a website here. They have a new Chinese resources website. You can go browse that. Heart and Stroke Foundation also make this. Dr. Yip mentioned that's the most common symptoms of a stroke, a sudden onset, first phase is droopy, not able to control the facial muscle. The arms, when the arms become weak, speech, and not enunciating well, slurring your speech. So this make us, when we see those symptoms, because it's sudden onset, it happens suddenly, so call 911 right away. Don't think about making a rest.
And then we also have the Stroke Recovery Association of BC, and that also has services in Chinese, and it offers information to the community, the resources in the community, and also some recovery plans so that you can get back to normal life in your community. They have a phone number. No, it's only a web page. You can visit that to find out relevant information, which is also available in Chinese. Next. Now, we can see here that the Stroke Recovery Association of BC has information in simplified Chinese, so you can visit that. And there is also one from the provincial government, a platform called Health Gateway. This is electronic health record. Many of you may not have visited this webpage, but you can do that. And then you can find your personal, may not necessarily be your medical history, but at least what kind of doctors you've seen, what kind of specialists you've seen, all that information is available on this webpage from the government. So, yeah, just log on that page and then you can access the information, because all the information is confidential. So only the person himself or herself can access that. The next one, you can see when you have been to a hospital. You can find out about your medications. They keep records for many years. So any medications, any changes in that, any lab results, your immunization history, how many shots, how many COVID immunization shots you have taken, all those are available. Another kind of service is also offered by the provincial government, which is HealthLink BC 811. It's a tool to find reliable health information. You can do that either by calling 811, and then someone will answer the phone. Mostly nurses. There are also nutritionists, as well as pharmacists and doctors on the line. And if your English is not good enough to comprehend, you can ask them to speak to Chinese with you, and you can speak to Chinese with them, and you can just say, "Chinese, please," and they will find people who speak your language for you. Next, please. Here, when you call this number, HealthLink BC, that is 811, you can find answers to your questions, and then there are nurses who will answer your questions. If necessary, you can also ask them for, say, where the clinics that are closest to you, what's the address of the hospitals, or the phone numbers, and they can also give you that information. You can also go to their website to find out information about health, all kinds of diseases, illnesses, symptoms. You can find out on those web pages. Next. Here, you see the web page. You can jot it down. If in the middle of the night, a child gets sick, has a high fever, you don't know what to do, whether the child should stay home or whether the child should go to the hospital. If those things happen, when you cannot find your family doctor, then you can get that service. Next. So hopefully after our presentations today, you have a better understanding of what a stroke is and how impactful it can be to your body in terms of your physical health as well as your mental well-being. Thank you for asking these questions, and I want to thank our speakers, Dr. Yip, Dr. Ho, Andrea Lau, Tigerson Young, Dr. Young, Patsy Lam, Pepper Wong, as well as Mr. Chris Chan from TransLink. And I want to thank our simultaneous interpreters. I'm not going to name them, for their hard work. And I also thank our community partners. There are more than a dozen of them. And again, I want to thank your participation in our presentations. Also, I want to thank our media partners, and there are 7 of them here, and helping us do interviews and other things. Also, a thank you to our partners at viewing hubs, which are Mosaic and Vancouver Second Mile Society. Here, we have the ways to contact us, iCON. So if you have more questions, you can either send them by email at iconproject.org, icon.support@ubc.ca, or Facebook and other media. And we also want to thank the Ministry of Health, the BC Ministry of Health Patients as Partners Initiative for their continuing support. So after we have listened to the presentations, we have acquired a lot of knowledge about stroke. Stroke is preventable, it is recoverable, and it is curable. So now we have imparted knowledge in the community so that they can reduce the risk of suffering these critical illnesses. I hope that you can spread the information to other people, and you can also view these presentations again in future after they have been posted. So I hope you enjoy a healthy and happy life. Thank you. Bye-bye.